Welcome to the deep dive. If you're listening, you probably want to get up to speed on the global urgent care center market quickly and thoroughly.
Exactly. And we've got this comprehensive report here. Our mission today is basically to distill that, pull out the really crucial insights for you.
Okay, good. So people understand the current state, future trajectory,
Right,
that sort of thing.
right. We'll look at market size for, say, 2025, where it's headed by 2033.
And the report breaks it down, like
Ah,
regions,
yeah,
services.
yeah. Regional breakdowns, segmentation by service type, even ownership models, plus, what's driving growth, what's holding it back, the competitive scene.
Got it. And the backdrop to all this is, I guess, the increasing demand for healthcare that's, well, convenient and maybe more affordable than other options.
That's the core of it.
Yeah.
People need timely care for things that aren't quite emergencies, but they don't want to wait hours or pay ER prices. Urgent care is filling that gap.
Okay, let's dive in then. Give us the big picture first. What kind of numbers are we talking about globally for 2025?
So the projection for 2025 is quite substantial.
Yeah.
Like USD 29,240 million.
29.2 billion. Okay, that's definitely significant. And the forecast, where does it go from there?
It's expected to climb quite a bit. By 2033, the projection is USD 45,215.64 million.
Wow, okay, 45 billion. That's quite a leap in what, 8 years?
It is. It works out to a compound annual growth rate, a CAGR of about 5.60% between 2025 and 2033.
5.6%. So steady, healthy growth year over year.
Exactly. It shows real sustained expansion in the market.
Right. Now, geography always plays a big role. Where's the action concentrated right now? Which region leads?
Currently, North America is the dominant player. It holds the largest share, actually over 40% of the global revenue.
Oh, for 40%. Okay.
Yeah, their market size for 2025 is estimated at USD 10,818.80 million. Urgent care is pretty well established there.
It really is. And their growth outlook, still strong.
It's respectable. The projected CAGR is 4.1% through 2033.
Okay, 4.1.
And within North America, the U.S. is, unsurprisingly, the biggest chunk. About $8.5 billion in 2025, though its CAGR is slightly lower at 3.9%.
Interesting. What about Canada and Mexico?
Canada's looking at around 1.3 billion with a stronger CAGR, actually 4.9%. Mexico's just under a billion, 984 million with a 4.6% CAGR.
And the driver there is still that preference for immediate, cost-effective options.
Largely, yes. That convenience and cost calculation seems key in North America.
Makes sense. Okay, so North America leads. Who's number two? Europe.
That's right. Europe comes in second, holding over 30% of the global revenue.
30%. Okay.
Their market size in 2025 is around USD 8,479.60 million. And their growth is pretty solid too, projected CGR of 4.7%.
Slightly higher growth than North America overall then. Any standout countries in Europe?
Yeah, the report highlights the UK and Germany. The UK is about $1.4 billion with a pretty strong CGR of 5.5%.
5.5.
And Germany is a bit larger in size, 1.68 billion with a 4.9% CER.
And what's pushing growth in Europe? Similar factors.
A bit different emphasis. The report mentions the rising burden on traditional healthcare facilities, like hospitals and clinics, as a key driver. Urgent care offers an alternative.
Right, relieving pressure on the main system. That's a common theme. Okay, let's shift to Asia Pacific. Often the story there is rapid growth. Does that hold true here?
Oh, absolutely. You're spot on. APAC currently has around 23% of the global revenue, so about USD 7 billion in 2025.
Okay, smaller share than North America or Europe right now.
Right. But here's the kicker. It's the fastest growing region by a significant margin. The projected CAGR is a huge 8.3% from 2025 to 2033.
Wow, 8.3%. That really stands out compared to the 4-ish% elsewhere. What's behind that boom?
It's a mix of things. There's just rapidly increasing demand for healthcare services generally, rising incomes,
The
urbanization.
usual drivers of economic development spilling into healthcare.
Exactly. Plus, there's a lot of investment going into evolving the medical infrastructure. Governments are often involved trying to expand access.
So if you're looking at investment opportunities, APAC seems like a key area to watch.
Definitely. The potential seems very high there. Within APAC, China is the largest market, nearly $3 billion, with a strong 7.8% CAGR.
Still very high.
And India, though starting smaller at around 700 million, has an incredible projected CAGR of 10.2%.
10%. That's really moving. Are there specific things like, say, tech adoption or policy shifts fueling this in China and India?
Yeah, we're seeing more digital health tech being used to improve access, telemedicine, things like that. And governments are pushing to decentralize care, take pressure off big hospitals. Plus, just growing awareness among people that urgent care is an option.
Fascinating.
Yeah.
Okay, what about the other regions? South America, Middle East, Africa, are they seeing similar trends?
They're smaller pieces of the pie, but still growing. South America is over 5% of revenue, about $1.1 billion in 2025.
And their growth.
Pretty strong, actually. A projected CAGR of 6.3%. Brazil is the main market there, around 475 million, growing at 6.9%. Increasing patient awareness is cited as a key driver.
Okay, Middle East.
Around 2% of global revenue, so about 1.17 billion. But look at the growth, 6.9% CAGR projected.
Also quite high.
Yeah. Saudi Arabia and the UAE are the leaders, with KGRs of 7.2% and 7.4% respectively. Again, awareness and the need for accessible services are driving it.
And Africa, still emerging market there.
Very much so. Around 1% of global revenue, maybe $640 million in 2025. The CAGR is projected at 5.9%.
Still respectable growth.
It is. South Africa and Nigeria are the largest markets mentioned. The driver is fundamental, just increasing demand for accessible healthcare as the infrastructure slowly develops.
Right. So growth everywhere, but really dynamic in APAC and parts of the Middle East and South America. Let's switch gears now. Inside the centers, what services are most common and where's the growth?
Okay, so the report segments by services like treating illnesses, injuries, doing physicals, vaccinations, diagnostics, screenings.
A pretty wide range.
Right. And the illness category, that accounts for a major share right now. Think common stuff like infections, flu, colds, things people want seen quickly, but aren't ER-level emergencies.
Makes sense. Volume alone would make that big.
Exactly. The convenience factor is huge there.
But is that where the fastest growth is? Or is something else picking up steam?
That's the interesting part. While illness is the biggest slice, the fastest growing segment is actually diagnostics.
Diagnostics, so testing.
Yeah. Think quick, accurate medical testing, screenings, figuring out infections fast, even some chronic disease monitoring.
What's driving that specifically?
A lot of it is advances in point-of-care testing, technology that lets centers do more tests right there on site quickly. Patients get answers faster.
So the tech is enabling urgent care centers to offer more comprehensive services on the spot.
Precisely.
Yeah.
It boosts their value proposition beyond just treating immediate symptoms.
Okay, that's a key trend. Now, who owns these centers? Is it mostly big corporations, hospitals, individual doctors?
The report breaks it down. Corporate-owned, physician-owned, hospital-owned, and sort of an other category.
And who has the biggest share currently?
Right now, hospital-owned urgent care centers hold the dominant share.
Why is that, do you think? The established brand.
That's a big part of it. Established infrastructure, that trusted hospital name, plus they benefit from integration referrals, shared resources, access to advanced tools maybe. Their existing networks give them a head start.
Okay, so hospitals lead in market share. But is that where the fastest growth is happening within ownership models?
Interestingly, no. The report identifies physician-owned urgent care centers as the fastest growing segment.
Physician-owned? Huh. Why might that be?
Well, it could suggest a rising demand for maybe more personalized care, something smaller practices can sometimes offer. Physicians running their own show often have more operational control too.
Leading to potentially more tailored or efficient models.
Possibly. It might attract patients seeking that kind of experience, or maybe physicians looking for more autonomy than in a big system. It's a really interesting counterpoint to the hospital dominance.
It really is. So, established players lead, but the independent physician-led model is gaining traction fast.
Okay, let's zoom out again. We've touched on drivers in different regions, but what are the main overarching factors pushing this whole market forward globally?
The report flags a few key ones. A big one we mentioned briefly is high wait times in traditional hospital emergency rooms.
That frustration factor.
Absolutely. People with non-critical issues just don't want to wait hours in an ER. Urgent care offers a much faster alternative for many conditions.
A huge selling point. What else?
Government policies and healthcare reforms in many countries are often supportive. They might encourage outpatient care, sometimes specifically incentivizing urgent care models to ease pressure on hospitals.
So policy tailwinds.
Right. And thirdly, just the general expansion of healthcare infrastructure globally makes it easier to actually set up and operate these centers in more places. Makes sense. Patient demand, policy support, and improving infrastructure. A good combination for growth. But surely there are headwinds too. What's holding the market back?
Definitely. The report points to infrastructure challenges, particularly in developing regions. You need reliable power, supply chains, trained staff. Setting up a modern clinic isn't simple everywhere.
Right, the practical realities on the ground, that can definitely limit expansion speed. What else?
The other restraint mentioned is patient preference. In some areas, or maybe for some demographics, people still prefer their traditional primary care doctor or just trust hospitals more.
Old habits die hard, maybe? Or perceptions about the scope of care?
Could be both. Overcoming that inertia and educating patients about what urgent care can do effectively is still a task in some markets.
Valid points. Okay, looking ahead now. Trends. What's emerging? What should we expect to see more of?
One clear trend is a move towards specialization.
Specialization, like not just general urgent care.
Exactly. Centers focusing specifically on things like pediatrics or orthopedics or women's health, for example, offering deeper expertise in a particular area.
Interesting. So niching down to provide more tailored care. What else?
Another trend gaining momentum is mobile urgent care.
Mobile. You mean vans or units that come to the patient?
Precisely. Offering home-based treatment or reaching underserved rural areas or just maximum convenience for people who can't easily get to a clinic.
Wow. Mobile urgent care. That really doubles down on the convenience angle, doesn't it?
It really does. It addresses accessibility in a very direct way.
Okay, specialization and mobile units, two key trends. Let's talk competition. What does the landscape look like? Who are the players?
It's quite a mix. You've got the big hospital-owned networks leveraging their scale and brand. You have independent clinics, often focused on specific communities, and increasingly retail-based providers too.
Like pharmacies adding clinics.
Exactly, offering basic urgent care services. So it's getting crowded.
What are the main strategies these players are using to compete?
Key strategies seem to be expanding their physical network. More locations equals more access. Integrating telemedicine is huge now too.
Virtual visits.
Right, virtual consults, follow-ups. It extends their reach beyond the physical building. And a big focus is just on enhancing the overall patient experience, making it smooth, efficient, pleasant. That builds loyalty.
It makes sense. The report mentions some specific tech advancements recently, real-world examples.
Yeah, a couple from late 2024. Xperity, which makes urgent care software, integrated AI into its teleradiology service to help detect fractures faster and more accurately on X-rays.
AI reading x-rays. Okay.
Helping the radiologists, yeah.
What?
And another one was BD partnering with Babson Diagnostics to expand fingertip blood collection tech into urgent care. Less invasive than a full blood draw, potentially faster results.
So tech making diagnostics faster, easier, more accurate fits that trend we discussed.
Exactly. It's all about improving efficiency and the patient experience through technology.
And the report listed some major company names.
It did. Names like Concentrate Inc., American Family Care, CityMD Urgent Care were mentioned as examples of significant competitors, especially in North America, with large established networks.
Okay, great. We've covered a huge amount of ground. Let's try and wrap this up for our listeners. Can you give us the key takeaways, the elevator pitch on the global urgent care market?
Sure. Okay, so it's a big market, nearly $30 billion in 2025, and it's growing steadily, expected to hit over $45 billion by 2033. North America leads in size, but watch APAC, it's growing incredibly fast.
Right, that 8.3% CAGR.
Exactly. Service-wise, treating common illnesses is the biggest part, but diagnostics is the fastest-growing segment thanks to tech. Ownership is dominated by hospitals, but physician-owned centers are expanding quickest.
Interesting dynamic there.
Yeah. Growth is pushed by ER wait times and supportive policies. It's held back sometimes by infrastructure limits and patient habits. And key trends are specialization in mobile units.
Excellent summary. Really hits the high points. So, considering all that, here's something for our listeners to chew on. What's next? What's the next big thing in urgent care that could really push convenience, affordability, and quality even further?
Ooh, good question.
Could it be, maybe, more preventative care somehow integrated? Or will telemedicine just completely reshape how it works, moving more and more online? Or maybe something else entirely driven by AI or new diagnostics?
That's the billion-dollar question, isn't it? Or rather, the $45 billion question. Where does the innovation focus next? It's definitely a space to watch.
Absolutely. Well, if this overview sparked your interest, definitely dig deeper into the full report or explore some of those trends we talked about. Thanks for joining us on this deep dive.
Thank you. It's interesting.